All right, buckle up, because today we're diving into some intense medical territory. We're talking life-threatening hemoptysis.
It's not a phrase you hear every day, that's for sure.
You specifically requested we unpack this research paper on managing the condition, and, well, it's pretty fascinating stuff. Even the name sounds kind of intimidating, to be honest.
It does have a certain ring to it, doesn't it? But you're right to be intrigued. We're talking about bleeding from the lungs here.
Right, and I think a lot of people might not realize even small amounts of blood can be a really big deal.
Absolutely. It's not always about seeing a huge volume of blood, surprisingly. While those dramatic cases where someone's coughing up a significant amount obviously set off alarm bells, even smaller bleeds, depending on someone's health, can be really dangerous.
So it's not just about the amount, but more about how vulnerable someone is to begin with.
Exactly. Imagine someone with, say, pre-existing heart or lung conditions. They're already working with a smaller margin for error, right? So even a little blood loss can be enough to tip them over the edge.
Like the difference between a small leak in a sturdy boat versus a tiny hole in a dinghy. The consequences are way more serious in one than the other.
Perfect analogy, and that's what makes this research so important. It points out that while only a small percentage of hemoptysis cases actually become life-threatening, somewhere between 5 and 14%, the mortality rate within that group is a sobering 9 to 38%.
Wow, yeah, those numbers really highlight how serious this can be. So what usually causes such severe bleeding in the lungs, I have to imagine it takes quite a trigger to get to that point.
You might be surprised. Some usual suspects are things like bronchiectasis, essentially damaged and widened airways, and of course you have lung cancer, which tends to pop up in a lot of different respiratory conditions.
Right, makes sense.
But here's the thing you might not expect. Even certain medications can be a factor.
Really? Medications?
Oh, yeah.
Wow.
It just goes to show how crucial it is for doctors to get a complete medical history from their patients, because every single detail could be a clue. It's like a medical mystery, trying to pinpoint exactly what's behind that bleeding.
Speaking of mysteries, the paper also dives into the anatomy of it all, talking about those high-pressure bronchial arteries as being the usual source of the bleeding. What makes these particular arteries so vulnerable?
Well, think of those arteries like a critical network delivering blood to your lung tissues. They're under constant high pressure to do this vital job, which unfortunately makes them more susceptible to inflammation and rupture. Any weak spot basically becomes a potential bleeding point.
Okay, so I'm starting to see how even a small problem in that area could quickly escalate into something a lot more serious.
Exactly. And to illustrate that complexity even further, the paper actually walks us through a case study that really brings it all home.
Oh, I love a good case study, because it's like piecing together a puzzle. Let's hear about this patient.
So picture this. A man in his late 30s with a history of HIV and tuberculosis arrives at the emergency room coughing up a significant amount of blood. We're talking a full cup.
Oh my gosh, that's a lot.
Definitely a cause for immediate action.
Absolutely. What did the doctors do first?
Given the severity and his history, they immediately intubated him to protect his airway. That's pretty standard procedure in a life-threatening case like this. He also needed blood transfusions, which tells you just how much blood he'd already lost.
Yeah, absolutely. So they were working to stabilize him, but the mystery remained. Where exactly was all that blood coming from? It's like you said, a real medical detective story.
Precisely. And like any good detective, they needed more clues, right? They ordered chest x-rays and CT scans, which revealed a large cavity in his left upper lobe.
Okay, so they're zeroing in.
And inside that cavity, what did they find? A mass of fungal material known as an aspergilloma, which is a common complication in people who already have existing lung conditions.
Ah, so the plot thickens. They found the source of the bleeding, but from the sound of it, treating it probably wasn't going to be easy.
It definitely presents its fair share of challenges. This case really highlights how crucial imaging is in these situations, because without those highly detailed pictures from the CT scan, pinpointing that fungal mass would have been so much harder, if not impossible.
That's incredible. So they knew where the bleeding was coming from, but how did they actually treat it? I mean, surgery in a situation like this has got to be incredibly risky.
You're right. Surgery for life-threatening hemoptysis has historically come with a very high mortality rate.
Yeah.
In this case, they decided to go with a much less invasive procedure called bronchial artery embolization, BAE for short.
BAE.
Yeah.
Okay, that does ring a bell. It's a much less invasive procedure, right?
Exactly. BAE has become the go-to treatment for these situations because it involves threading a catheter through the femoral artery in the groin all the way up to those leaky bronchial arteries.
Okay, I'm trying to picture that. So they use this catheter to, what, block off those arteries?
Precisely. They inject tiny particles, often little spheres, that essentially plug up those leaky arteries, preventing further bleeding. Imagine plugging up a leaky pipe. Same idea.
Uh-huh, that makes sense. And in this man's case, did it work? Was the embolization successful?
It was. The bleeding stopped. However, he did end up experiencing recurrent bleeding about a month later.
Oh, no. What happens in that situation? Is a second round of BAE an option?
It can be, and often is. Repeat BAA is a pretty common approach for recurrent bleeding. However, in this particular case, given his history and the nature of the aspergilloma, they ultimately decided to surgically remove the part of the lung where the bleeding originated, which in this case was the left upper lobe. They did a left upper lobe resection.
And that was successful, thankfully.
It was. They were able to confirm the presence of that aspergilloma, and thankfully there was no evidence of any further complications. 3 years later, he was doing well.
Wow, what a roller coaster. This case really illustrates just how complex managing life-threatening hemoptysis can be. It's not a one-size-fits-all approach, that's for sure.
Absolutely not. It's a real team effort involving pulmonologists, radiologists, surgeons, a whole medical orchestra, you could say, working together.
Teamwork makes the dream work, right? Now, we've talked about how effective BAE can be, but I'm curious about how they even diagnose this in the first place. The paper mentioned chest x-rays, CT scans, and bronchoscopy. Are they all equally effective at pinpointing the source of that bleeding?
That's a great question. And the answer, as with so many things in medicine, is it depends.
Oh, I knew there had to be a catch. Okay, so let's break it down. What are the pros and cons of each method?
Well, chest x-rays, those are often the first step because they're
Yeah.
quick and, readily available in pretty much any medical setting.
Of course.
The downside is they don't always give you the clearest picture. If the bleeding is minimal or the patient has really complex lung structures, it can be like trying to find, as they say, a needle in a haystack.
So you need something a little more high-tech in those cases.
You got it. CT scans are like upgrading to that high-resolution image, They
Yeah.
let doctors visualize even the smallest abnormalities, which gives them a much better shot at pinpointing that elusive source of the bleeding.
But even then, you mentioned there are situations where a CT scan still might not be enough.
That's right. Sometimes a patient is just too unstable for a CT scan.
Oh, right.
Or maybe the images aren't conclusive enough, especially when you're dealing with bilateral lung disease, where the bleeding could be coming from multiple different areas. That's when bronchoscopy comes into play.
Ah, okay. So this is the one with the tiny camera, right? I've heard of it, but what makes it so useful when these other methods we've talked about kind of fall short?
Well, it allows for a level of precision that's really hard to beat with anything else.
Okay.
It's minimally invasive, but it allows for direct visualization and treatment of the airways.
So they can actually see what's going on in there.
Exactly. That's bronchoscopy in a nutshell. So doctors can use it to not only pinpoint that bleeding site with incredible accuracy, but they can sometimes even perform interventions to actually control the bleeding right then and there.
That's incredible. So it's both a diagnostic tool and a treatment option in some cases.
Precisely. It's especially invaluable when doctors need to get a closer look. NAD potentially need to act immediately.
It sounds like having all these tools at their disposal really gives doctors the best possible chance at, quickly diagnosing and treating life-threatening hemoptysis. Speaking of treatment, we've talked a lot about BAE and how effective it can be, but you mentioned that the bleeding can sometimes reoccur. What did the research paper have to say about that?
That's a really important point. While BAE has really revolutionized how we manage this condition, boasting immediate success rates as high as 99% in some studies.
Wow.
The reality is that recurrence rates can range anywhere from 9.8% to a whopping 57.5%.
That's a huge range.
Yeah.
What factors influence those numbers so much? Why is there such a big discrepancy there?
Well, several things, really. The underlying cause of the bleeding plays a big role.
Okay.
Things like aspergillomas, like that one we saw in the case study, those tend to have higher recurrence rates because that fungus can be really difficult to completely get rid of.
Oh, okay.
And then with conditions like bronchiectasis or tuberculosis, the airways are already damaged and inflamed,
Right.
which makes them just naturally more susceptible to rebleeding.
So even if you stop the bleeding in the moment, it might not be the end of the story for that patient.
Unfortunately not. And it just highlights how important careful monitoring and really thorough follow-up care are for these patients.
And what happens when the bleeding does recur? Is a repeat BAE the usual course of action?
It can be, and studies show that it's generally just as safe and effective the second time around.
Okay.
But again, it's not a magic bullet, and sometimes you need to consider other treatment options.
Like those other bronchoscopic therapies we touched on earlier.
Exactly. The paper talks about several different techniques,
Yeah.
and the best choice really just depends on the specific situation. The location, the cause of the bleeding, that sort of thing. For instance, if the source of the bleeding is visible and accessible through the airways, doctors can use lasers to cauterize the bleeding vessels.
Lasers for the lungs. That sounds incredibly precise.
It is. They can also use something called argon plasma coagulation, which achieves a similar result using heat instead of light. And then in certain cases, they might use bronchial blockers, which are basically these tiny little inflatable balloons that tamponade the bleeding site. So they're essentially just putting pressure on the wound until it clots.
Wow. Those all sound incredibly advanced.
Yeah.
But you're right, I can see how those techniques would only be suitable for certain types of bleeding.
Mm-hmm.
What about situations where those less invasive options just aren't viable?
Well, then it becomes a question of whether surgery is the best course of action.
Which, as we know, carries its own set of risks.
Sure.
So when would a surgeon actually step in? In what scenarios?
Well, sometimes BAE just isn't possible.
Well-
It might be the patient's anatomy.
Right.
Those blood vessels might be just too difficult to reach.
Okay.
Other times, the bleeding might recur multiple times despite repeat BAEs,
Yeah.
which suggests, a more complicated underlying issue.
So in those more serious cases, surgery becomes a last resort.
It can be, but it's important to note it's not always an emergency procedure.
Right.
The paper points out that when surgery can be planned in advance, after the patient is stable and they've been thoroughly assessed, the outcomes are much better.
That's reassuring.
It really highlights the need to explore every avenue and weigh all the options carefully before jumping to the most invasive solution, which is often surgery.
It's about finding that balance between urgency and, like you said, careful consideration, really.
Exactly.
So we've covered the diagnostic tools, BAE, additional bronchoscopic therapies, and the role of surgery. It's like we've assembled a whole toolkit for understanding and managing life-threatening hemoptysis.
We have.
But what about preventing it in the first place?
Now you're thinking proactively. And it's a crucial aspect that really deserves a lot more research and attention. While this particular paper focuses mainly on managing active bleeding, the idea of identifying at-risk individuals before they even have a crisis that's incredibly compelling.
Because if you can catch it early, you might be able to prevent it altogether,
Exactly.
or at least lessen the severity.
Right.
But how do you even begin to predict something like that?
That's the million-dollar question. It's not as simple as, a blood test, unfortunately.
Oh.
But there are definitely clues if we know where to look.
Like what? What kind of things put someone at higher risk for this?
Well, think about the usual suspects for lung problems in general. Smoking history is a big one,
Of course.
as is exposure to certain environmental toxins. Family history of lung disease is another factor to consider.
So it's about looking at the bigger picture,
Yes.
not just like isolated symptoms.
Exactly. Right now, it's a lot of connecting the dots.
Right.
But just imagine if we could develop more sophisticated screening tools, maybe incorporating more advanced imaging or analyzing specific biomarkers. We could potentially identify those, leaky pipes
Agree.
before they even start to drip, so to speak.
Now, that would be incredible. It's like preventative maintenance for your lungs.
Exactly.
But it sounds like, for now, being proactive about lung health in general is the best defense we've got.
It's a great place to start. Quitting smoking, if you smoke, that's probably the single most impactful thing you can do. And just being mindful of potential environmental triggers.
Right.
Things like air pollution, workplace hazards, all that plays a role.
It's amazing how much power we have to really impact our own health in the long run.
We do.
Now, I know we've covered a lot of ground in this deep dive. But before we wrap things up, I want to make sure we distill all this information down into something actionable for our listeners.
I agree. It's one thing to understand the science, but it's another thing entirely to know what to do with that knowledge.
So for someone listening who might be facing this diagnosis themselves or maybe knows someone who is, what's the most important takeaway from all of this?
I'd say the most important thing to remember is there's hope.
Okay, good.
As serious as this condition is, we're talking about life-threatening bleeding here.
Yeah.
We've come a long way in understanding and treating it. Treatments like bronchial artery embolization have been a real game changer.
Yeah, it really does seem like it.
It's a minimally invasive solution with incredibly high success rates.
Yeah. So it's not, an automatic crisis situation.
Exactly. And while, yes, the possibility of recurrence is something to take seriously, medical teams are getting much better at identifying those risk factors and really personalizing treatment plans to minimize that risk as much as possible.
And a big part of that is early detection,
Absolutely.
which really means listening to your body, not ignoring those warning
A
signs.
100%. Even if it's just a small amount of blood, or frankly, you're not even sure that's what it is, getting it checked out is always the best course of action.
Right. Better safe than sorry, as they
Yeah,
say. We
exactly.
talked about, the power of those lifestyle factors, but it's worth repeating here. This isn't just about reacting to symptoms after the fact, but like building a strong foundation for your lung health in the first place.
I completely agree. Things like quitting smoking if you smoke, that's huge. Avoiding exposure to lung irritants, things like that, and maintaining a healthy weight. All those things can significantly reduce your risk of developing the kind of lung conditions that we know can lead to hemoptysis.
It really is empowering, I think, to realize how much control we actually do have.
We do.
And then finally, for anyone facing this diagnosis, you're not alone.
That's such a crucial point. Lean on your support system, family, friends, support groups, whatever you need. Don't be afraid to ask your doctor questions, get a second opinion if you need one, and just, be your own advocate throughout that process.
Yeah,
Knowledge is power, and understanding your condition is always the first step toward managing it effectively.
I love that. Knowledge is power. And with that in mind, I think we've reached the end of our deep dive into the world of life-threatening hemoptysis. We explored the causes, the diagnostic tools, the different treatment options, and even touched a little bit on those exciting possibilities of prevention.
It's been quite a journey.
It has.
Hopefully, our listeners feel a lot more equipped to navigate this complex and sometimes pretty confusing topic.
I hope so too. As always, a huge thank you to you, our listener, for joining us on this exploration. We're so glad you chose us to be your guides through this fascinating and sometimes, a little intimidating area of medicine.
Until next time, stay curious.